vital signs, the easiest way to do so is to click on the vital signs button in the bottom panel of the screen. This will take you over to the vital signs sensors. You can then use your mouse to manipulate your view of the screen. You can then click on this multi-sensor tool, which once you click on it, it will automatically move you over towards the patient. You can click on the patient and then it will become highlighted. Once it's highlighted, you can click again and it will attach to the patient. The vital signs tab now is highlighted. You can click on that vital signs tab again and it takes you back to the screen. It now gives you a heart rate, a pulse ox, and a blood pressure. If you would like to put the patient on telemetry, you can click on these EKG leads. It will then automatically move you back to the patient. You hold the EKG leads over the patient until they're highlighted. Once they're highlighted, you click, and now they're attached. And if I click this vital signs tab, it then takes me back, and now the patient's on telemetry. If you would like to know the patient's respiratory rate, you can then click on this respiratory sensor.
Thank you.
Again, I come over to the patient. I click on her. Here's the respiratory sensor. I move it over her face because that's where it goes. I click, and now it's attached. Notably, this is not a nasal cannula. This is meant to be your end-tidal CO2 and will also give you your respiratory rate. Most patients in the hospital will not need an end-tidal CO2. There it's used in certain clinical settings. But now I can see my respiratory rate and I have all of my vital signs populated.